And welcome back. I'm Mabel Jong. You're watching continuing coverage of the World Healthcare Congress 2018, coming to you from Washington, D.C. This is day one. I'm so pleased to have in our studio Dr. Rhonda Robinson Beale, Chief Medical Affairs Officer at Blue Cross of Idaho Foundation for Health, Inc. How are you, Dr. Robinson Beale?
I'm doing fine.
Thank you so much for your time. In your work, in Idaho, you're looking at different social determinants of health to address the needs of your population as best you can. What are you finding so far?
Well, you know, it's very interesting. Idaho is 3/4 rural, and about 15 counties is actually frontier. So we're really dealing with majority in terms of the healthcare system, a rural system. And we all know from research and statistics that those in the rural communities are far more affected by social determinants than in an urban community. So what we're finding is that there are health disparities that we see between those who are in rural areas and those that are in urban areas, even in Idaho. Things like certain cancers are more prevalent or statistically more prevalent in some districts and not in others. We see that major injuries or death from major injuries are more prevalent in the rural areas, as well as suicide because of the isolation that goes on there. So there are issues that really stand out and very glaring that really become areas that we can focus on to try and address.
Okay, so now that you know some of the issues that you're having to tackle, what strategies are you putting in place to address those issues?
Sure. So working with the foundation, which is very different than working with the health plan, we're very interested in the community itself. So our focus is on the community and the providers in the community and those who are members of the community. So what's very important in terms of dealing with social determinants is beginning to address those issues and trying to get the community involved and empowered as well as excited to begin to be engaged in making those transformations. So what we've done lately is to use a tool called the Community Health Management Tool, which is a geospatial visualization tool that allows you to see on a zip code level all the social determinants of health in that zip code. So you begin to get a really good idea of what are the things that stand out in that particular community that might be things that are target. What's good about the visualization is it's easy to explain to county officials, state officials, as well as the common population. And it begins to help them to understand and help them to begin to prioritize or understand the significance of certain, what I would call determinants, social determinants in their community that could very well be affecting access to good health care.
Wow, that's fascinating. So almost like a Google map or something?
Exactly. It looks like a Google map, but you put a lot of different things, like you'll show you where all the ERs are or where they're not. It'll show you the density of the population. It'll show you what the wind patterns are.
Why is that significant?
Well, that becomes significant in terms of several things. One, particularly in agricultural areas where you have pesticides and other things that are being spread, you really want to know how that's going to affect the community and how far does that affect the community. Also, certain roads are not very well traveled when the wind pattern is too high, because those roads, those very circuitous roads in the mountains, become a little more dangerous to drive.
Interesting. So are you able to put out maybe a public health alert or something like that to let people know that that's coming, spraying in certain times of the year, or what do you use that information for?
Well, as the foundation, we're just starting to really delve into this, and so usually those are things that the Department of Health and Welfare would look at in terms of the parts that deal with agriculture, the parts that deal with infections, and also with the prevalence of diseases. But as a foundation, we use the information we have to help those organizations look at a combination of information. So they may have information about the wind patterns and they may have information about the pesticides, but they don't know what the prevalence of certain diseases might be in that area. And so the tool that we use not only uses survey information, but also uses claims information, so you can look at the prevalence of certain types of diseases in those areas.
Okay. You also participated in a panel today.
Yes.
Tell me what some of the takeaways were that you shared.
Well, I think one of the major things we talked about, because there were various presenters from health plans, they were dealing a lot with how to gather information on the social determinants of health. So they were using things like HRAs or surveys. For us, we're doing those types of things, but right now we're focusing in on getting all local kind of information that can be on a zip code level that we can load into this tool, because again, our major focus is, as a foundation, is to get the communities motivated and excited about making changes in their community, the needed changes in their community. And this tool makes it very easy to see those issues. This helps in terms of cities and counties that are doing planning as it relates to whatever transformational changes that they're making as it relates to roads or new water systems. These are the kind of things that kind of add to their decision making that helps to address those social determinants of health.
Dr. Beale, it's so great to talk with you today. Thank you so much.
Thank you. I appreciate being here.
And thank you for watching. Stay tuned while we come back with more content.